everybody. Happy Med 13L month. Happy Apraxia Awareness Month. So many good things. So this is Laura, and well, I'm Becca, and I have a son, Cooper. He's 4.5. He has Med 13L. But my journey started before we found that out, when I actually our speech language pathologist in the desert had, I think it was like 2.5, had suggested that she thought he might have apraxia. And as all us parents do, we go down the rabbit hole of research. And in that, I came across Laura, who is just a wealth of knowledge and so powerful in the way she presents her information, because it's also her lived experience. And so she is a speech language pathologist, and she also has a daughter with apraxia and I believe a rare genetic condition. Am I speaking correctly? Yeah. Not Med 13L, but similar. And so she has walked a similar journey as us, farther along than me, but has a lot of experience. So I just wanted to, in case people didn't have time to read the article yet, we do have an article that is gone for peer review and to be published with the NIH. And it basically is just showing that our population really does demonstrate high rates of motor speech disorder. They did a study at the 2022 Simon Searchlight family meeting, and of 17 individuals, all presented with some motor speech disorder. And then there was also a cohort of virtual research that was done with 67 that also reported traits of a motor speech disorder. So this is super high in our population. So I think that this will be so informative. I think some of the first things I came across from Laura just rang so true for my experience with Cooper. And the first time I was lucky enough to meet with Laura when I came to Denver, I saw a significant difference in what a typical speech therapy session looks like to what a motor-based speech disorder session looks like. So that's just kind of a brief overview of my story and how I found Laura, and I think we can get started.
Okay, thank you, Becca. That was so nice. Yes, I remember Barnes and Noble meeting
Yep.
little Cooper, baby Cooper, really.
I know. Feels like forever ago.
Yes, so hi everyone. My name is Laura Smith. I'm a speech language pathologist out in Denver, Colorado. And my journey with apraxia started before my daughter was born, because I was a speech pathologist before my daughter was born. Back in '09 is when she was born. So she's a freshman in high school now. And I had just some preliminary experience with apraxia. I'd taken like a couple workshops, nothing huge, and I treated 3 school-age children. But it's a lot different when you're treating school-age children with, they're just a different profile of a student. They have better attention, they have the ability to sit, they're further along cognitively. And apraxia of speech, though, we really want to be getting it as early as we can, because the earlier the better affords the best outcomes, honestly. And so I'm so excited to do this. I wish there was an organization for my daughter's genetic disorder. She also has one. Hers is a mutation called on BCL11A. And in the research for BCL11A is reported childhood apraxia of speech. And it's so interesting, because we talk about all the time that first diagnosis is what sticks. And so if I were to have gotten BCL11A first, I don't know what path I might have gone on, but we got childhood apraxia of speech first, and that's the path I went down. Like Becca said, going down that rabbit hole. And I was able to, even more than the average person, just because I could just take every single training known to man that I could related to apraxia. And I give workshops on it now, and I will tell you guys that every single thing in my workshop, every single thing was learned after I went to graduate school. I did not learn anything I present on in graduate school. And so, did I know that there was childhood apraxia speech coming out of graduate school? Yes. Did I know that it was a speech sound disorder? Yes. And so, when you call SLPs and ask them if they have experience with apraxia, they're going to say yes, because they had preliminary kind of information But most likely they do not have the training to treat it appropriately. And so what they'll end up doing is treating it like every other speech sound disorder, because we do treat speech sound disorders. We treat something called phonological disorder, articulation disorders, even speech delay. And treatment approaches for those speech sound disorders are not effective for childhood apraxia of speech. And that is likely, if a SLP has not taken postgraduate education, that is likely the methods that they're going to be employing. And so, yeah, just really childhood apraxia speech. If I could just implore you, like, I just remember last year, I think I did this last year, and just, telling Becca and Katie, I think both of you were like, wait, I think I just had an aha moment. I'm not sure my child is in the right speech therapy. And it's likely they're not. And so it breaks my heart, because, like, you go down, like, that first diagnosis sticks. So we're all heavy on the genetic disorder, but we're not realizing that CAS, like, it just requires a completely different treatment approach. And so I'm happy to be here to give you guys this information. And I implore you to ask questions of your SLP, be annoying, get curious, um, because it is, like Becca said, totally different. It's a more direct form of therapy. We need to be using verbal visual cues, and there needs to be a different cue for every single sound that we have. So I just recently started seeing Becca Cooper again, because she moved to Colorado, which is where I'm at. So it's very fun, and Cooper's already responding amazingly to just the cues that we're using. So yeah, I guess that's kind of it in a nutshell. Why did we get here? Why are we here? Why is there so little information? The body of, like, the organization that certifies SLPs, the American Speech Language Hearing Association, acronym is ASHA. ASHA only officially recognized childhood apraxia of speech as its own separate and distinct speech sound disorder in 2007. So I graduated grad school in 2008. Think about everyone older than me. It wasn't even officially recognized by ASHA, which is why it wasn't in the curriculum of grad school. So they're getting better. From what I hear, it is in the curriculum of a lot of grad schools now. But then it's one thing to have it in the curriculum, and it's another thing to have experience treating it. So unless they came across a child with apraxia of speech in their externships or internships, they still might not have the experience that they need to effectively treat your child. And again, the earlier we can get them in this motor-based treatment, the better, because it affords the best outcomes. So even in my Facebook group for BCL11A, when I see, older children who are limited speaking, it breaks my heart, because they just trusted the SLP to help their child, not realizing that they could have been using a very different approach to helping them. So not to scare anyone, I just want to make it powerful so that it, like, has an impact on you guys. I'm really passionate about it. Today is actually Apraxia Awareness Day. I'm wearing blue and have my bracelets on. So I'm just happy to be here spreading more awareness to help all of your children with this disorder. So that's kind of it in a nutshell. Do you think I covered a lot?
Yeah, Laura, I just want to echo your sentiments, exactly what you were saying too, because Simon Searchlight did they did an informational meeting for us, and there was a speech pathologist in either Australia or New Zealand. And Laura, I think you were
Yes,
familiar
it was
with her.
Angela Morgan. I wanted to
Yeah.
go to that. I saw she was presenting.
Yes, and I'll put it in the chat for anybody who wants to watch it as well, just showing that it is an international therapeutic approach to speech. But I took that information to my speech path, and she's like, you know what? No, I think it's it's Met 13L. They wouldn't really give you an apraxia diagnosis because he has Met 13L. And so I went back to Laura, and Laura shook her head like she's shaking right now. And
I'm just
so,
like,
but so just for you to know, that's probably some feedback you may receive. And so that's why there's a Zoom, there's a presentation on YouTube that I'll put in the chat for you to send all of your speech paths showing how a clinical assessment was done on our children. And they do have apraxia and dysarthria. And then this new publication that's still in preprint, but it is very impactful and important. So send that to your speech path as well, just to make sure that they're getting the right therapy. Because just like Becca, after meeting with Laura, I did switch, and Colin has been making a ton of gains with speech. It's still,
Yay.
and
Oh, good.
yeah, it's been amazing. He's 4 years old. It's still unintelligible, but he is speaking in sentences. I don't know what he's saying, but it's still like we're at step 1, but we're making progress and it's huge. And so I'm just really grateful and so glad that everyone else gets to listen to you.
Yeah, and apraxia of speech is a lifelong neurological disorder. I was just on the phone with someone, like a new client, right before I hopped on here, and she was trying to see. She was wondering why, like, if her child would qualify for Medicaid, why that would work with apraxia, but not all the other diagnoses that they had. He has expressive language disorder, developmental delay. And that's because those are coded as developmental disorders. And in theory, if it's developmental, you grow out of it. You do not grow out of childhood apraxia of speech. You will always have it with you. And you can have, there's a variety of different outcomes. I've seen individuals who are still pretty severe to profound and unintelligible. And I've seen individuals where I, as a speech therapist, can't detect that there is a problem with their speech. So, it is recognized as a disability for a reason. And yeah, we just want to get them in the right treatment approach. And it is a marathon, not a sprint, because it is a lifelong neurological disorder. It is a marathon. So it's not surprising that your son is still unintelligible, Katie, but it is so promising that you finally see the progress. And that's what we want. So yeah. Yeah, these kids are with me for a while. These kids are with me for a long time. I'm happy to like open up the floor to any questions. I mean, feel free to drop them in the chat. Feel free to just shout them out.
And I'll give it a second. Does anybody have questions? And then I can kind of ask some questions that might prompt more if that helps.
I have a question.
Yes.
This has just been kind of a personal annoyance, and I'm just wondering your opinion on our speech therapist. Well, now I'm doubting it, but she supposedly specializes in apraxia. She's super young though, so I don't know, like, how much experience she has, but she wears a mask. And it drives me crazy because I'm like, how is he supposed to watch your mouth and like imitate, what you're doing? What are your thoughts on that?
So I did a that's a good question, and I'm qualified to answer this because I actually was a clinician in a study that was the effects of DTTC if you're masked because it was around 2020. So we wanted to make sure that this method for apraxia worked with a mask. And the caveat being they have to see your mouth. So you can wear a mask, but we had to wear clear masks or have a mask with a window so that they could see your face. And the research showed that with that, it was effective. They didn't do a comparison of not seeing your face, but it just kind of goes without saying you'd have to see our face.
Yeah.
So that's really unfortunate that she is her mask clear, do you know?
No, it's 100% not. And I'm just like waiting for it to come off. I'm like, we're in 2025. What's happening?
Yeah. Yeah. There's something called mirror neurons. And mirror neurons is when they're looking at your face, like it causes us to kind of imitate someone like a mirror. And so really having access to your mouth and looking at your mouth is really helpful. I will say I have children, like on the spectrum, for example, who are adverse to even looking at my mouth. And so in that case, we still use cues, but I might get cue cards of pictures of a mouth, and then I'll show them like use your humming sound, and it shows the mouth like that, or like use your whatever sound, and it shows the picture of how the mouth would look. So, yeah.
Okay. Same page.
Yeah.
Thank you.
Stacy said, with this being recorded, will we be able to share this video with our SLPs? I don't mind if you share it with your SLP.
Yes, we'll make it available. We'll put it on our YouTube page so you can just send the link to them. Thank you again, Laura.
Yeah.
Elizabeth, do you have a question?
Yes. So I live in a pretty rural area. I know I'm not going to find an apraxia specialist anywhere. We actually just got a non-telehealth speech therapist for my son through the school. Is there any like resources that you could share that I could forward to both his SLPs. They're both young. They're very eager to learn. They have a great attitude, but there's just not a lot of resources around where I live.
Yeah. There is actually a free, so childapraxiatreatment.org. I'm pulling it up right now. Childhood. The man who founded that private nonprofit did so because his youngest child had apraxia, and it wasn't until he found Edith Strand, who teaches the course on that website, that his daughter finally started to make progress. And he asked Edith Strand why. And supposedly, she told him it's because a lot of people don't have this training. And so he is funded, his nonprofit is funded for a free training for SLPs taught by Edith Strand, and they get continuing education credits, which is very important when you're an SLP. You want to take trainings that afford you that. So let me drop it in the chat, and I would definitely send them that because that's for free. There's literally no reason that they wouldn't do it. You know what I mean?
Can I also plug your Instagram?
Oh
It's
yeah,
really
sure.
helpful as
Thanks.
well. Becca, even before I met you, put me onto your Instagram, and you have a ton of helpful videos, information. So I'll put your handle in the chat as well.
Yeah, thank you.
The other thing that I found really helpful, Laura, when I first found you was your podcast. I think it's made more for clinicians. And there's one where you're talking with 3 other apraxia specialists, but it really kind of gave me listening to you 4 talk about it pushed me to be like, I have to advocate for this. Like, this is so clearly different than what we're receiving. So I can put that in the chat too. I know you haven't done it in a while, but there's some ones previously that were, I thought, so informative and really helpful for me to understand the difference and how to advocate and why it's so important. So.
Yeah, definitely. Thank you. I'm so glad that was helpful. Yeah, I haven't done anything with my personal podcast. I have done some podcasts for the Apraxia Foundation. So that's a podcast too that you guys might want to check out. But yeah, good. I'm glad that was helpful.
Yeah.
It says, I have a question. My 4-year-old daughter already has the diagnosis of speech apraxia. We've seen therapists at the Kaufman Center who are supposed to be well-trained, but their approach didn't seem very different. This might be because she's still young, have cognitive delay and difficulties in social skills. I was wondering if there's a different way to approach this. I mean, if you were at the Kaufman Center, they should be trained in what's called the Kaufman speech to language protocol. And so you should have been seeing the cueing that I talk about. They would have a small target word list that they're working on. I'm not sure if I don't know, maybe you did have good therapy before you went to the Kaufman Center. Even a kid with cognitive disabilities, like my daughter's genetic mutation, also as part of that genetic mutation comes with intellectual disability. And a lot of times I will hear that as an excuse, like, oh, well, they don't understand the cueing. They don't understand, so I can't do it. But I've never found that to be a problem. I can teach them the cues. It might take longer than a kid without a cognitive disability, but I've never found that to be an impediment to therapy for apraxia. Dysregulation, yes. So a child who's completely dysregulated, a child who is completely unable to pay attention whatsoever, like if that's the case, yes. But if I even have a little bit of attention, we can get somewhere.
Is there an age that you wait to start this kind of therapy, or?
That's a good question. So Asha says that a diagnosis of apraxia before 3 is challenging just because just a variety of reasons like behavior, the child might just be learning to talk. But when we have something like this genetic MED13L, or we have something like my daughter's mutation where we already know that apraxia is there, then the recommendation is to treat it as suspected. And in fact, there's a lady called Beat Peter, and she has research on something called Babbel Boot Camp, and she starts at infancy. So if she knows there's a genetic disorder that has a child predisposed to childhood apraxia speech, she's got this course called Babbel Boot Camp and encourages SLPs to change their treatment approach from infancy. So if you're not in infancy, don't worry. You didn't miss the boat. I'm just saying that that's there. But anytime in early intervention, like before even age 3, we can treat it as suspected, and we will still change our treatment approach, because typically what SLPs are doing in early intervention, they're either doing parent coaching or they're doing something called language stimulation. And language stimulation is really just kind of, you know, imitating the child, trying to model easy targets, but it's not this direct form of therapy, like directly getting them to try and say things. So, yeah.
I just want to pause for a sec, give people space to ask questions if they want.
Yeah, you're good.
We have a question.
How can we tell if one has apraxia? Our 7-year-old isn't even attempting to make sounds. So technically, to get a diagnosis of apraxia, the therapist has to do something called a motor speech exam. And a motor speech exam does require the child to be verbal enough to be able to look for characteristics of apraxia. We're looking for 3 characteristics. ASHA designates 3 must-haves. The first one is inconsistent errors on repeated production of words. So that's hard. If your child is not speaking, we wouldn't be able to tell that. The second one is difficulty with co-articulatory transitions. That's just a fancy way of saying they have difficulty going from one sound to the next, one syllable to the next, one word to the next. It just depends on where they are in their speech system. And then the third criteria is some sort of prosodic disturbance, and prosody could include intonation, pitch. Most likely what we see with apraxia is equal syllabic stress. So instead of saying like tomato, they might say like tomato. So it's kind of, you know, this robotic stress. So you're not gonna be able to see that if they're non-speaking, but there are definitely signs, even if a child is non-speaking, of apraxia that could flag it. So limited babbling well, first of all, let me start off at birth. A lot of in case histories for apraxia, I see difficulty with latching. Usually this gets diagnosed as a tongue tie or something like that, or just parents will say, I don't know, it was hard, but we worked through it. That's like a early sign. It could be an early characteristic of apraxia right there. At 6 months of age, we want to see children babbling. So ma, 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 da, 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 just be the same consonant and vowel kind of system over and over. A lot of kids with apraxia don't do that. If they do that, by the time a child is 9 months, we want to be seeing indicators of what's called variegated babbling. Variegated babbling is where they're changing those consonant and vowel combinations. So instead of da da da, we might have da ga da ga da gi da ga. You know, they're just doing more playing with sounds like that. That is frequently not there in profiles of children with apraxia of speech. Delayed first words, obviously, is a red flag for childhood apraxia of speech. Any other motor planning in the body. So if we see you know, how can they imitate non-speech oral motor movements? Are we able to round our lips on demand? Can we retract our lips on demand? Can we, you know, try to put our tongue up to our nose? And we try and put our tongue down? Can we put our tongue side to side? If they're not able to follow these directions, or they are able to follow it, but it's labored, it's not just fast and easy, those are indicators that motor planning is an issue. And when you add respiration and phonation on top of that, those are highly complex systems. And so you're more likely to think the cause of the speech is because of apraxia. So all of those kind of like red flags would cue us to at least suspect it and change our treatment approach. You know, I had a 5-year-old, that just reminds me, when I worked in the schools, this is actually before I knew anything, really. I mean, I did research on a website, but this kid came to me and he was 5 and he was nonverbal, but he had goals that were speech sound goals. So at some point he must have been, otherwise they wouldn't have made those goals. But he wouldn't say anything. And I think he was just so aware that talking was hard and he couldn't do it, that he was completely shut down to even trying anything. So with apraxia, I tell SLPs in my workshops all the time, I make a lot of allowances for a child with apraxia because we have to inspire motivation. So our tendency a lot of the time is to like sit down, do your work, blah, blah, blah. When really a child with apraxia needs this inspired motivation. So what is going to inspire them to do the hard work that is apraxia therapy? And for this kid, I literally took out a beach ball and he loved it. And I was like, just say anything, just, and he finally did it. And that's where we started. So, yeah, she said, thank you. I think she has more of an intellectual disability because she doesn't respond yet. Yeah, and that definitely could be the case.
Laura, I feel like talking to you is a lot of aha moments, because even your like failure to latch, difficulty latching, like I think a lot of people are like, yep.
Yeah, totally. It's interesting that I had asked on, because it's Apraxia Awareness Month, so I've been really active on social media where I'd taken like a hiatus, a sabbatical, I feel like. But I had posted on my Facebook what was some signs where you first realized your child had apraxia, and a bunch of people put latching in there. And then other people were like, what? Why would latching have anything to do with apraxia? But it could have been the motor plan of like suck, swallow, breathe. I think that's how it goes. I might have that wrong, but it's a motor plan. So that's why it could be an early indicator.
If other people are kind of having any of those aha moments or kind of what they think was the first thing that would have been their sign, I'd love for you guys to put it in the chat. And I think this is really important information that we could get out to the community too, just to help people understand this is what it is and this is how you can help your child. Or if you don't want to put it in the chat, you can email info@med13l.org, and we'll put something out there to everyone just so we can all talk about it and share resources, because that's why we're a community.
In prompt therapy, but I feel like the tendency is to do AAC, and AAC I'm a huge proponent of. I absolutely agree with AAC. But a lot of children find frustration with AAC as well. And when they are able to communicate verbally, I see behaviors decrease, even if they were like, I'm thinking of this one boy with autism, and he was fluent on his AAC, fluent, but still had a lot of behaviors. And they brought him to me because he started showing some interest in imitating sounds. And we were able to break through that motor planning component. And he is so happy now. Like, even if it's just saying what he wants to say, like he likes saying 1, 2, 3 and like dropping things and having that like just reinforce, like, yeah, 1, 2, 3. He's so happy. Like, he has no behaviors anymore. It's crazy. And he did have access to communication with an AAC fluently. So I think they even get frustrated sometimes too, and rightfully so. Also, I just wanted to mention, you guys, Katie, you can save the chat too. Did you know you can do that at the end?
Sure didn't, but
yeah, I learned this in this company I work for where I give workshops. So if you click the 3 buttons in the chat, and everyone can do that, and then put save chat, it'll save it for you, and you can save it to your computer.
Oh, perfect. And then we'll maybe post it in the description when we post this on YouTube. Wealth of information,
totally.
Laura, what are some questions that parents can ask to find out if their speech therapist currently is like what are some ways to weed it out? Like, are they really an apraxia specialist, or are they that student that went to school and learned about it and thinks they know, but maybe like isn't official?
Yes, wonderful question.
Yes, I actually have a blog post on that. Let me find it. And it was like 10 questions to ask your SLP.
That's wonderful.
Let me find it.
And like maybe like strategies in session to tell the difference.
Yeah, let me do that in a second. Let me grab this first. Okay.
Yeah, I was gonna ask, so the small word list we're doing, but you're talking about having a specific cue like with each word. Could you like show some examples of what you mean by that? Because we have the small word list, but we don't have cues that you're referring to.
Yeah, definitely. Let me just show you. Do you mind if I pull up Cooper's word list, Rebecca? Just
totally.
Rebecca, for the sake of
and you can use any
looking at it.
And,
Okay, so this is I haven't made pictures yet, but I just started with Becca's child because I can now. So this is her target word list. So this is his small target word list. And so let's just go through. So go, I put 2 fingers to my throat and I say use your back sound. So the fingers to my throat is a visual cue and back sound is a verbal cue. So I'm doing 2 types of cueing for him. And so use your back sound, go. No, I say your engine sound or your no sound. It depends on what the child understands, talking about receptively. There's nothing magical about my cues. There's nothing magical about these cues. These are the Bjorm sound cues that are really popular. There's nothing magical about anyone's cue. The magic is the cue is effective and the child understands what it means. So we have to teach it to them first. No is your engine sound, and I put it here. So this is my visual cue. Use your no sound. No. In Cooper's case, he doesn't round his lips. So then I'm like, round your lips. No. when I'm like making a circle with my mouth, so he knows to round them. Me, I usually say humming sound, and I slide my finger across my lips. C is a snaky sound. Use your snaky sound. C. Popcorn sound. I either do this or I do this. Pa. It just depends on what I think the kid responded to best. So those are some examples, but every single sound in this word list has a separate and distinct cue. So hopefully that helps answer your question.
Yeah, I think that does help. We have some of those, but definitely not for every sound. So that's interesting. Can you share those cards that you briefly picked up too?
Oh, yeah, these are the Biorum sound cue cards. Jenny Biorum is an Apraxia expert. She's one of the people that Becca said she listened to on a podcast I did. I had her on a lot.
Okay.
Yeah.
Thank you.
And those are cool. We just learned how to use those last summer with a therapist we saw in Pasadena who would like because I don't know about everybody else, but like Cooper has a hard time stringing sounds together. So he'll usually get the front sound and miss the end sounds. And so those cards are cool for like showing. I think it does require help from somebody who knows how to use them because I was not using them correctly on my own.
Yeah, because the thing is too, is that we don't want to promote segmentation. Segmentation can be a place where you get stuck. So, I've seen videos of children who can string the sounds together. But again, like that second criteria of the ASHA 3 is difficulty with co-articulatory transitions. That's exactly what Becca just described in a parent way. So thank you, because sometimes I feel like I know too much. I'm like, do people even understand what I'm saying? Like, so yeah, that's exactly the issue. And so I'll see kids, I've seen a video of a kid where he's like, for mom. Well, yeah, he's stringing the sounds together, but it's segmented and that's not functional. So just making sure that we have strategies to keeping your voice on and making that a smooth transition from one sound to the next. Lots of people saying latching issues. I know, it's so interesting. Oh yes, my daughter had issues of choking too. Oh my God. I am like PTSD from choking issues with her. And like technically the term for feeding difficulties is some sort of why am I not thinking of the term? Dysphagia? There's a term for feeding issues. I just don't work with feeding. But I feel like motor planning was really involved in that too, obviously, because and actually, you know what? I'm glad you brought that up because my daughter had it's called it was like this type of chew pattern when technically you're supposed to have a rotary chew. And a rotary chew is how the food forms into this like bolus. A bolus is like all the food is together in the medial backside of your tongue. And then you swallow it and it all goes together. But if you're mashing it and you don't create a bolus, you get a lot of like drooling, you get a lot of food on the face, you get a lot of choking because it's not all going down nicely. And so I hired a speech therapist in home, and we did speech therapy for feeding 3 times a week because I wanted her to use the principles of motor learning, which she did not know. She knew what to do with feeding, and I knew what to do with principles of motor learning. And that is how we taught my daughter, like systematically, in a very systematic way, to do a rotary chew, create a bolus, and now she can swallow correctly without all of this choking stuff. So that is important. I'm glad you brought that up.
Another issue that we have is my daughter has hypotonia. She was like a limp noodle when she was born. So even just chewing and stuff like that is a real challenge for her even now when she's 14.
Yes. So Becca briefly mentioned this, but you can have a co-occurring motor speech disorder with apraxia called dysarthria. And it frequently occurs, especially in genetic conditions. I'm not for sure with Med13L, but for sure with my daughter's genetic condition.
It is in Med13L in the publication and in the Zoom presentation that I put in the link. So.
Oh, perfect. Okay, so it does.
Yeah, and
so
it wasn't everybody. It was some kids just had apraxia. Some people had both. And
okay.
Yeah. So.
Yeah. So if you have dysarthria, that is a weakness in the articulators, and like what they'll recommend, like there's this it's like, what is it called? Myofunctional therapy is recommended typically if you see this in a child that is very dysarthric and weak. I will tell you that the research is not great on myofunctional therapy, even though I know people love it. I tried it, even though I knew the research wasn't great, because I just wanted to make sure I was doing everything for Ashlyn that I could. And I'm sure you guys relate to that. You're just like, whatever, even if I waste my money, I have to know I at least tried. It was so pointless for her to learn that. It was a complete waste of money and time. So I say that from personal experience. And then what I did is I did that. I switched to that in-home SLP who had courses in feeding. She'd taken advanced. Here's the other thing, you guys, speech language pathologists, our field covers birth to geriatrics, from speech, language, feeding, swallowing, cognitive. There is no way you can be an expert in all of it. You can't, like, coming out of grad school. So I specifically requested someone who had taken advanced training and postgraduate education in feeding. And then she came in, and that's how we tackled that feeding problem. And it was amazing. It was night and day from the myofunctional therapy. I mean, my daughter couldn't even chew without closing her lips. That's how weak her lips were. And so what the myofunctional therapist wanted me to do is like hold a button behind her lips and like do these exercises. No, you know what worked the best was functionally practicing with certain foods first and trying to keep our lips closed while we did it. And it was a very, very slow process, but she can finally chew with her lips closed.
That's cool. Thank you.
Yes, you're welcome. Yeah, huge with water still, said Megan. Ashlyn chokes on water too. And it's a motor planning thing. We've had the swallow study. It's not swallowing. It's just like, Ashlyn, are you breathing or are you gulping? Because you're gulping. You know, so yeah, it's that pattern, right? It's even for that, we have to know how to motor plan the swallow, the breathe. Like, you can't be doing it all at the same time. So anyway, yeah, same with Ashlyn.
Laura, there are a few questions up a little bit. I'll summarize them real fast for you. I think before when we talked, you sent me a link about like Apraxia providers. Was there a link that had Apraxia providers? And I can look for it too while you keep presenting, because Christy had a question about that.
Yeah, if you go to, there's a couple places to go to for that. If you go to that childapraxiatreatment.org, you can find a therapist that's trained in DTTC. Apraxiakids.org also has a find a therapist tab. And then Prompt, the website, it's harder to find, but Prompt also has a tab where you can search for SLPs.
Awesome. And then Lori, who's the Met13L grandma, and there's another Met13L grandma, Kimberly as well. So thank you guys so much for coming on. We love that. And I actually have experience with this, but I'll let Laura answer it. She's asking about traditional sign language is a helpful component cue for efficient therapy.
I've used it before. If the child knows it, I won't teach them it that way. But if a child comes to me knowing, I absolutely, like, this is the sign for D, I'll still do it to my mouth. I'll be like, use your drumming sound, duh. Or, you know, use, what's this, like B. Yeah, use your B sound, buh. And so I'll still use my cues with the sign if they know it. Because again, there's nothing special about my cues or anyone's cues. What's special is the child understands them. So if he already understands them, cool. Like, we can go that route. And I will say that adults who I've talked to with that have grown up with childhood apraxia of speech, at least 2 of them went to a specific school in high school to learn sign language as their foreign language component. And they both say that sign helps them get their words out. So
thank you.
I've seen a huge improvement with, like, my son, he'll sign milk, but he'll just say meh, meh. But his favorite character is Moana. So we do Moana, and like then he'll say it. And then one of his caregivers is Ivana. Both just come out as Anna, but with these cues, it's Ivana.
nice.
Then he'll say it. So like it prompting with the sign and the sign going along with like the emphasis in the word makes a huge difference. With like, and then with just milk, he'll just like look at me and just do the creepy milking a cow motion. And I wish it was something else, but it's and even just like stop. It really helps.
It does really help, yeah. And the reason they say that is because motor helps motor. So motor neurons firing together help another motor component. So yeah, that's great.
So I would really be open to the cues that like the speech therapist encourages, even if it's a little different, because I've seen a huge difference.
Thank you.
That's awesome.
There's a question that says, do you have any experience with Patavan therapy? I don't know if I'm saying that right.
I've never heard of that.
Me neither.
So no.
I haven't heard of that either. Yeah. Okay.
He also learned sounds from AAC usage. Yes, I have seen kids who their AAC can sometimes become, so as you progress, you might not need these sound cues anymore. You might, sometimes the model of the word becomes a cue. And so just hearing your model, they'll be able to repeat it after you. And so I've seen that too, where kids can repeat on their talker. But the reason the reason cueing is important, if I haven't mentioned it, is because apraxia starts in the brain. It is a problem with planning and programming the movements for intelligible speech. So that's why cueing is so important, because the cueing is helping us help them plan and program these motor plans on their own. And so even if they imitate a model, you still want to get them away from being cue dependent on that. And another way you could do that is sign. So like when I'm teaching a child with a language disorder and apraxia to combine words, a lot of times I'll just make up signs. Like if if I'm having them answer where questions, like, where, I have this video of one kid, where's your nose? And he goes face, but I want him to use all the words. So I'll be like, and he'll go on. I'm like, your, and then face. Yes, because I'm trying to get him to motor plan that whole thing and not just me providing the model. So that's another way that's called sign cues that can be really effective for kids.
Are there other
Oh
questions?
yeah, there is Apraxia Kids Canada. I feel like there's another organization in Canada. I'm not coming up with it right now. I do. The thing is I'm only licensed to practice in my state. So that's how it was with Becca. She had to move here to Colorado, and now I can see Cooper.
I did. I will say, I mean, this is just a side note, but we are doing virtual right now because I'm about an hour away from Laura. And I didn't know how it was going to go. Cooper's 4. I thought we were going to be hands all over the computer, like chaotic. And it's been going great. He's already like I was saying, he drops end sounds, but this week he multiple times has done like full, like eat.
He
help.
did? Yay!
Like, oh my gosh, so many times. Up. Like he was always up.
Yay!
Like he like is putting them together. And we've had what, 3 or 4 virtual sessions?
Yeah, that's so exciting.
I know. And this is just a question for you. And this is like a struggle that goes with insurance and all of the things, but I think the other thing that is really important that I learned from you was the frequency of like session. Like what's the typical recommendation for apraxia? Because a lot of
3
times
to 5 times a week.
Yeah, and insurance will approve like 1-hour session and you're like, well, that's not the recommendation.
Yeah, 3 to 5 times a week. I will say that 5 times a week, I really only reserve for my like profound, like if they're really profound, I will recommend 5, but that's rare. Like Cooper, ideally for someone like him who's verbal, he's talking, but he just has a lot of errors. I usually go for 3, which we can't do yet, but I usually go for 3 for someone like that. Someone said, oh, I think someone answered them. What do you mean by cueing?
Oh yeah.
Visual cues help my daughter. Good. I know it is hard to find providers, and it's just that's why I'm here though, because at least you don't know what you don't know. So at least you know now that you want to find a provider who does truly know how to treat apraxia of speech.
Yeah. Is there anyone else on Instagram or social media that you think posts good videos that would be good examples if people are curious?
Yeah,
Like,
Bandara Speech is the one who's killing it right now. In the past, I would have had some others, but Yeah, Alana Bondar, so she's called Bondara Speech. She posts videos all the time. It's solid. She also has a parent course. I've only checked out half of it, but it was solid stuff coming from her.
Yeah, and she posts like actual videos of sessions, which
Mhm.
I've, and
Mhm.
that was the exact one I was thinking of, Laura.
Oh, nice. Perfect. Yeah. She's the one killing
I
it
just wanted to
there.
make sure it was approved by you.
It is, definitely. She's great.
Cool. Well, we have about 9 minutes. I want to be respectful of Laura's time and everybody's time. Does anybody have questions they haven't been able to get out or anything we want to pass along?
I put another question in
Sorry,
there.
did we miss it?
I didn't want to ask again because I feel like I already asked a question, but I said my son has just started imitating. He's 6 years old. He seems very unmotivated to use his device, and he's not, to clarify, he's not imitating any speeches. It's all gross motor, like high fives, like that's basically where we've been at. And we've been working on it for 4+ years. Well, probably his whole life, but with an actual therapist for 4+ years. Any advice to get him motivated or to help him with imitation? Because I feel like all of these ideas are great, but he has to be able to like follow basic instructions and also imitate a little bit.
Yeah. Yeah, for sure. I mean, I would say with anything related to motor planning, which using an AAC also involves motor planning, is we have to inspire motivation. So the sessions have to be set up where he's just highly motivated by whatever you're doing. And so I mean, I've bought $60 worth of dinosaur crap because the kid wouldn't do anything unless I had new dinosaurs available every session. But that they have to be inspired to, and the reason is because I liken it to if we're looking at speech or even AAC usage as a motor act, and not all the time AAC is, but at least for speech, if we're looking at it as a motor act, think of something athletic, sporty that you have no interest in doing, and a person is now making you do it. What is going to inspire you? Because I am not intrinsically motivated to snowboard. I was intrinsically motivated to please my husband and thinking this could be a fun activity for both of us. I do not like it. So what else are we going to do to get me to do that? And so that's kind of where we're at with these kids. Sometimes with speech is like, what is motivating for them that they just want so bad? Maybe it's swinging. Maybe it's spinning in my office chair. Yeah, if he can imitate gross motor, though, you might even start like working in some signs that then you can bridge into speech. Because if he's doing high fives and things like that, he's getting that. And so continue with the imitating gross motor and working on those imitative skills. Does that answer your question?
And Elizabeth, you said you're in like a rural area, right?
Yeah. I just looked up, and the closest one in my state, there's only 4 in our state, and the closest one is like 2.5 hours away. That's on the website. So, and like both my speech therapists are like, I feel like highly motivated. If I like showed them some videos and some skills, like they would work on them. But they're also really young and just very energetic. But it's a very frustrating case because I've been, working with what I have and getting him like literally he used to high five, he used to wave, he used to actually have words back when he was like 12 months, but then he lost them about 18 months, and then he also like went through like a silent period, and now he makes sounds, but they're not anything else, he's not trying to make words, he's just making sounds, and trying to get him to imitate has just been such a struggle. So I guess like that's kind of just like trying to see, where do I go? Do I focus more on the AAC? Do I try working on babbling? Do I try working on imitation? There's just like so many things to work on, and basically like motivation is very low for him. So
An option that I don't do them because I don't have any time to do them, but there are people around the country who you could drive to. I think Becca didn't you go to my friend Lisa?
I never actually went to we never made it.
Oh, okay. But there are people around the country who can do a comprehensive evaluation for you and then look at your child's strengths, look at where they're at, and then recommend a treatment plan and where to go. And that would at least give you a starting point from someone that you're sure knows what they're doing. So that I know it would probably be expensive, but I think it would be worth it since you've gone through 4 years of frustration anyways.
Yeah, and I
That's an
think, I
option.
mean, it'd be worth it to reach out to those 4 people in your state and see if they do virtual, because that could help. And then the other thing that for me and is that like we have our speech therapist and then we have an AAC person that we just started seeing
Yes.
separately. And like
Yes.
that's all she does. So she doesn't work on the imitation or the sounds. She just works on AAC. And this is, but I think just speaking to Laura's like point of motivation, like the thing they just did with Cooper's, we've seen like a huge jump in his AAC recently too, use. And I think it's, the school found a few things that he really liked. So he has a button that says like, hi, my name is Cooper. What's your name? And they like went around and did it with every kid in the class because we just moved and he's new and he loved it. And then he's like started doing it at home with different like people that have come in and out. And then the AAC specialist that we see. So if, I think AAC would be harder to do virtually. Personally, I could be wrong. Laura, you could speak to that, but it'd be worth it to look and see if any of those Apraxia people in your state do virtual. I'm sorry, you're struggling with that. I know that feeling.
Someone wanted to know what AAC means. It stands for Alternative Augmentative Communication. The way that we're using it in this talk, though, is more regarding speech generating devices called SGDs. And so a speech generating device is something on like something that looks like an iPad or might even be on an iPad with a, yeah, there we go. Oh, Becca's got Cooper's up. That's an AAC device called a speech generating device. And you push the buttons and it speaks the word out loud for you.
I have one last question if we have time.
Yeah.
So my son will often get stuck. He kind of, if he's trying to like speak too quickly or you know, his thoughts are kind of like ahead of his mouth is kind of how I feel. And he'll just get into this like aya like where he doesn't. And what's your recommendation? Like, do you stop them? Do you like? I don't know what to do when he gets stuck like that.
Well, without knowing the etiology, I'm not sure how to advise you. A couple of things could be going on. They could be stuck in something called a motor loop. If you don't follow Jordan from Fighting for My Voice, he just did a fabulous video on motor loops. And essentially, they can get stuck in what's called a well-rehearsed motor loop, motor plan. So that could be happening. And then if that's happening, we might give them strategies to stop that. But I've also seen kids do that when they started stuttering, unfortunately. So sometimes stuttering can co-occur with apraxia. So then my advice would be different if it was stuttering. And they might be stimming. I don't know if he has autism, but it could be a verbal vocal stim. So without knowing your child and the etiology, it's hard for me to tell you what to do.
Yeah, it's probably a motor loop, I would guess.
Okay, if it's a motor loop, yeah. Yeah, check out that video from Jordan. But if it is a motor loop, giving him a lot of feedback, like you're saying I, but I just want I. Feedback, I didn't mention this yet. Feedback is a critical piece of apraxia therapy. We're giving them something called performance feedback. And with performance feedback, we're giving them knowledge about what their articulators did and what we need them to do. So I heard I. Open your mouth and just say I. Or, you know, I have, if it's like ma, like, oh, I heard that's too many. You did it 3 times. You said ma. I just want it 1 time.
Okay.
Ma.
Okay.
So that is what I would do for that.
Okay.
If it's a motor loop.
Yeah, I'm pretty sure it's only that one thing. And it's not when he's trying to say I, it's like he's wanting to speak a full sentence and he can't. And so he just, that comes out. Yeah. Okay.
Two more questions in here. I just want to make sure we get to. One said our son has 1 50-minute speech session per week. He can't say more than 5 words. Should we increase therapy time? He also has orofacial therapy twice a week. I want to know your thoughts on that, Laura.
Oral facial therapy. If you're referring to what's called oral motor exercises or even oral placement therapy, there's nothing in the research that shows that's an effective therapeutic approach for apraxia. Apraxia needs a motor-based speech approach, and the most common approaches, not the most common, the most evidence-based approaches that we have right now with the highest level of research are DTTC. There's something called REST out of Australia. If you guys heard Angela Morgan speak, that's kind of what they do in Australia, but it's free materials. REST is another approach that a therapist can access with all the free trainings, videos, materials available on the website, taught directly by Trisha McCabe. They won't get CEUs for it, but it's all there. So I don't know if someone can look up that while I'm talking. And then let's see, DTTC, REST, prompt, and the Kaufman speech to language protocol has some preliminary evidence, but I feel like it's a really good method if the therapist was trained in it. Not if they just bought the box and are doing a box with you, but if they actually went to a workshop and learned how to do the Kaufman speech language protocol. So
Okay, and then one more really quick that I thought was a good question was, well, they're all good questions, but another one that we hadn't touched on was, since the Apraxia course is free, that's the DTTC, I think it's a 1-hour training that's free. Would you recommend parents take it to try to incorporate it at home, or do you think it would be beyond our knowledge?
well, actually, it's an 8-hour training, I think. It's an all day. Like you can do modules. They don't have to sit down in one day and do all of it. You can do it in pieces. And I don't, unfortunately, this is the unfortunate part, is I don't think parents are even allowed to go to these. Like they're not like, I hate to put it that way, but I don't think they're allowed to do it. What you can go to though, that I think will give you a lot of information, and it's virtual this year, is Apraxia Kids is having a virtual conference. And so everyone can access that anywhere. I don't know when registration is closing, but it's soon because it's going to be in July. So if you're interested in learning more, Apraxia researchers will be teaching lots and lots of courses at that conference, and that is available for parents and professionals.
Can you send a link for that, Laura?
Yeah, let me see.
And you can send it to me if you want later, and I can put it on the Facebook page.
Well, it'd be nice to have it in the chat because we can all download the chat after this, so it's okay.
Yeah. But isn't there a 1-hour DTTC one on just online that parents could do, or no?
I mean, if there is, I don't know about it. If you could find it, that's awesome.
Let me look.
Okay, here's the link for that conference. Oh, we found it at the same time.
Oh,
Oh man, it's the same dates as the Med 13. Of course it is.
of course it is. Okay.
I appreciate that you know that, Laura, and maybe they'll record some stuff that we can send out to the community after.
Yeah. I did not know it's the same date. Megan told me in the chat. I'm not that good.
I was very impressed. Like, Vanessa, our graphics are working.
All right. Well, it's 10 o'clock. Should probably wrap up. Laura, not enough thank yous in the world, but like, you've just been such a good resource for me. And I think this information is so important. If there's anything I would have wanted to know 4.5 years ago, this is exactly it. So thank you.
Yay.